You know that feeling, right? That little creak in your knee, maybe an ache in your hip. It's so easy to just write it off as, well, I'm just getting older. But what if that whole story, the one we've all been told, isn't really the whole story at all?
I mean, that's the big question, isn't it? Is this just something we have to put up with? Are our joints just wearing out, kind of like old tires on a car? Well, let's really dig into that. To get to the bottom of it, we're going straight to the source. These are some handwritten notes from a medical lecture. And honestly, what they say completely flips the script on what most of us believe is happening inside our bodies. So let's break it down together.
All right, first things first, we have to talk about the idea that's been around forever, the wear and tear theory. It makes sense, it feels right, but as we're about to see, it's just not the complete picture. For the longest time, this was the accepted narrative. Osteoarthritis, or OA, was seen as this one-way street, a passive thing that just happens to you as your body breaks down. But that whole way of thinking kind of leaves you feeling powerless, doesn't it? And these notes show us there's so much more to it. So let's get to the big reveal from these notes. It's time to forget about that idea of passive decay. We need to start seeing osteoarthritis for what it actually is, an active, dynamic process, and here's the key part, it's one we can influence. This right here, this quote from the notes, it's a total game changer. Just listen to those words, active, dynamic, imbalance. This changes everything. It's telling us that OA isn't your joints just giving up. No, it's an ongoing battle inside the joint, a real tug of war between your body's ability to repair itself and all the forces causing destruction. So this is the big shift in thinking we need to make. Over on the left, you've got the old story, passive, inevitable, just kind of doom and gloom. But on the right, that's the new reality. We're moving from something that just happens to you to a process your body is actively fighting in. And that means it's manageable. And that's exactly why the notes call OA a syndrome. It's not just a problem with your cartilage, it affects the entire joint. Think of it like a tiny ecosystem in there. You've got the cartilage, the bone, the ligaments, the joint lining, and they're all part of this dynamic dance. Okay, so if it's an active imbalance, what's tipping the scales in the wrong direction? Let's follow the chain reaction step by step to see how OA actually develops. So what kicks it all off? Well, the notes point to a bunch of different things. It could be a big injury from your college sports days, or maybe the steady mechanical stress from carrying extra weight. But it's also biological stuff, Things like your metabolic health, your genes, they can all be the little spark that lights the fuse and throws that repair versus destruction balance way off. And here's how that fuse burns. Yeah, it might start with some damage to the cartilage, but then your body responds. It sends out all these inflammatory signals. That inflames the lining of your joint, which just makes the destruction happen even faster. And finally, the bone itself gets involved and starts to change. It's a full-on biological domino effect. Okay, we've seen the dominoes fall. But remember, if this is an active process, it means we can actively do something about it. And that brings us to the best part, the toolkit. This is where you get to step in and take back some control. And the notes are absolutely crystal clear about this. The foundation for managing OA is not a pill. It's these core things right here. It's about reducing the load on your joints, building up the muscles around them with the right kinds of exercise, and just learning how to manage it day to day. This is always where you start. Now, once you've got that solid foundation, that's when you can start layering other tools on top. Medications are there to help you manage the symptoms, like pain and inflammation, so that you can actually do the foundational stuff, like your exercises. One of the most common tools, of course, is NSAIDs. You've got the classic non-selective kind, like ibuprofen. They work, but they can be a bit rough on your stomach. Then you have the newer, more selective COX-2 types, which are made to be easier on the stomach. But they have their own potential issues for your kidneys or heart. See? It's always a trade-off, and that's why it's so important to work with a doctor to find the right fit for you. And the toolkit doesn't stop there. For some people, it might include things like tramadol or injections that go right into the joint to provide relief, or even other types of drugs that tackle the more complex sides of chronic pain. And this little summary from the notes just ties it all together so perfectly. You can see the whole strategy laid out. You start with that lifestyle base, then you add on the medical tools as you need them. From simple creams to pills and injections, it's all about building a personalized, layered plan. Okay, so let's zoom out and bring this all home. What is the single biggest takeaway from this whole new way of looking at osteoarthritis? This, right here. This is the whole mission. The goal is not just to make the pain better today, it's to slow the progression of the disease. Just let that sink in for a second. The things you do can actually change how this plays out in the future. That's huge.
And that right there is the big mindset shift. You're not a passive victim of wear and tear. The second you understand that OA is an active, dynamic process, you go from being a patient to being the active manager of your own joint health.
So I'll just leave you with this one question. This isn't about fixing everything overnight. It's about taking one step. Now that you know all this, what's just one thing, one small step that you can do today to actively help your joints for the long haul?